I'm a registered nurse. I've been a nurse for about 10 years now.
I've been in private practice just a little under 3 years, almost 3 years.
It affected my personal life in the fact that I live alone and I had to be alone a lot. I'm very active in clubs and things, and so I've always had somewhere to go, something to do. But with the pandemic, I had to stay home.
It's been crazy. And so at the time that the pandemic hit, I was really kind of in the height of practice. And so things were very busy for me. And the pandemic hit, and for 60 days, the courthouse was closed. And so my work essentially came to a very abrupt halt.
In the beginning, of course, the isolation was getting to everybody, but I say it gave us all the opportunity to stay grounded, reconnect with what's important, with family, our priorities.
When you go into nursing, people always tell you your whole life, oh, go into nursing, you'll always have a job. A lot of nurses have been laid off during this time because of hospital cutbacks. I believe it was April 15th. We had a meeting with our manager, and she basically told us that she's going to have to drastically cut hours, that they're going to allow her to have one nurse in the department for 4 hours a day. There's 4 nurses in my department, and that she immediately needed us to get off the clock.
I'm a teacher at Frederick A. Douglass High School. I teach world history and pre-law, and I operate the Law and Public Safety Academy program at Douglass.
I am currently a work-at-home mom to 3 beautiful children, 11, 2 years old, and 8 months.
I am an educator here in Oklahoma. I am in elementary school. I have 4 grandchildren. I've been an elementary librarian over 10 years, and I've taught school for over 40 years.
I have 2 young children, both they're early elementary age children.
The week before spring break, they came in on a Thursday and told us that to go home, and then we'd have spring break, and we'd probably be back after spring break, but we haven't been back yet.
We got out of school for a spring break, and we never went back. Thankfully, my children's school they were pretty good about going ahead and addressing the issue, and they put in place a distance learning solution pretty quickly. But with a kindergartner and a K3er, that takes a lot of your time. It was a lot trying to homeschool the 2 of them.
And so that was a big deal that we didn't go back. And then the district that I teach in then kept us very busy contacting our students every week to make sure that their well-being was good as far as we could check that. And then they began talking about how we would come back to school, and they purchased some distance learning software. And so in case we came up against this again, then we'd be ready for it.
My oldest, who will be a 7th grader this upcoming school year, it kind of halted everything for her, so it started with that. After spring break, she didn't return back to school. She was supposed to start her first track season, so initially it just kind of halted the way that the house ran.
We lost a lot of time. Besides it being such a hardship for our seniors, we were robbed, and they were robbed of opportunities and closing out the school year and connecting them to resources that they need to get ready for the next school year and the next chapter in their lives. So it was a hard hit for everybody.
I believe that the response was not handled properly from the top. And I'm not trying just to bash anyone, but I believe that for a while, they didn't believe that it was going to take the effect that it had, have the impact that it had, that it was going to be like the flu. It would be here in a matter of 2 or 3 weeks, 6 weeks, that it would pass.
Of course not. No, I don't think it's been sufficient at all. Our government knew that this was coming. They watched what happened overseas and failed to adequately prepare for it.
There are precautions that we could have taken beforehand that we wouldn't have arrived to where we are now. I think a lot of people were careless, not taking this as seriously as it should have been taken. And that's not just on the political level, even just everyday citizens. Not taking the proper precautions, being careless with other people's health and compromising other people's health. It was completely selfish and it could have been handled way better.
But coming back to school this fall, I'm nervous because, you know, you really have the potential to have, 20 kids to a classroom. Again, my kids are small, so they don't really understand social distancing.
For me, it's not an option. Like, I've talked to several coworkers and friends about it that are going to keep their kids at home or do the online option. Edmond Public Schools has the brick and mortar where you can go full time in the school building, or you can do it all online.
I have thought very much about my grandchildren when they go back, especially my little ones. I believe that 14-year-old one has pretty good common sense, and she should know the social distance. She should know how to keep that mask on her face. The ones I'm concerned about more are my little ones that love all their friends. They run up to them, they hug them, they want to be pals, they want to play football, they want to roughhouse around, they just want to be close to their friends. And keeping a mask on at 5 and 6 years old is going to be a task. And I feel like the teachers are going to spend a lot of time telling children to put their mask on and being told, I can't breathe.
They need to take it with use the right precautions to protect everyone. I mean, not just sanitizing, but they need to make certain that individuals wear masks, that they've got the distancing aspects taken care of, that they've got the proper number of individuals in a classroom that's acceptable, so everyone is safe. I mean, and that goes from the principal to the custodial staff.
When making plans for the new school year, they didn't do a lot of talking to their essential people, the principals, the secretaries, the teachers, the bus drivers. They just decided this is what you will do, but they didn't talk to us basically and find out what we know as teachers, and we're there with those kids all day, every day, even without the pandemic.
I heard, our federal government get out there and say, well, we made a commitment, we made a promise to our kids as far as an education is concerned, but really in line with providing them with the education, you have a promise, an obligation even to protect them, protect their health, to protect their lives at all costs, and it doesn't matter.
The instruction that we've gotten so far has been very vague as far as the division between primary, elementary schools and secondary schools. We've heard anything as far as A and B days, where certain days throughout the week would be virtual and the other would be face-to-face. We've heard there will be an option for either for you to come face-to-face or take the virtual option.
I don't have a problem with what the school has in place. I think the school is doing what they can with what they can, or they're doing as much as they can. So they're not allowing backpacks in the school. They're doing temperature checks. I don't believe in that process, but okay. They are not allowing drinking from the water fountains, which I totally agree with. School lunches, home sack lunches are allowed to come to the school, but they have to be turned into the office every day, so they're not floating around. Lockers are no longer being used. Every student will be assigned a Chromebook, and they will have a 3-ring binder to carry around with a Chromebook, so they don't have to get books, take things home. They just have those 2 items that they take with them every day.
So the risk is health, your health.
If you look at these other countries and the way that they've handled it and the position that they're in now that their children have to go back to school, is you can tell where our priorities lie.
With the lack of concern, I feel, for the people, they're more concerned with the economy. So if, citizens have to be guinea pigs, or if they have to be casualties in order for the economy to stay afloat, I feel like that's where they are. That's their premise. I'm not a fan of it. I don't like it, but that's why it's important to vote.
I would like to see us go back safe. That's what I'd like to see, as safe as we can get. I feel like because our numbers in Oklahoma are very high, 600 one day, 700 one day, 1,000 one day, 99 one day, they're so varied and they're going up.
At the beginning of the pandemic, or even before we knew that it was an actual pandemic, when the coronavirus first was introduced, the numbers were nowhere near what they are now in the United States. And if they felt the need to shut the schools down then, I'm not understanding why they would feel the need to open them back up when the numbers are, again, almost 1,000 people testing positive a day. With that, no, I don't see a need for the schools to open up right now.
All it takes is one person to affect many. And if you get one child or one teacher or one administrator who's infected, they can affect the whole school.